Welcome back to Smart Lawyers Love Dumb Nurses, the podcast where data meets reality, where credentials meet consequences, and where the people who do the most work often carry the most blame. I'm your host, Brian Smith. Today's episode is inspired by a deceptively simple question. What do nurses actually do all day? Not what television shows us, not what juries assume, not what administrators promise, but what the data says, minute by minute, step by step, across real hospitals, real shifts, and real nurses. And the answer may surprise you. The study I'm talking about is a large multi-hospital time and motion study spanning 36 hospitals and hundreds of nursing shifts. The researchers didn't rely on self-reporting. They didn't use estimates. They followed nurses in real time, observing and categorizing every single task performed during a shift. Every walk down a hallway, every medication pass, every note typed into an electronic record. The goal of the researchers was simple. Where does nursing time actually go? Here's the headline finding, and this is the part that rattles people. Direct bedside patient care accounted for only about 1/5 of a nurse's total working time. Let that sink in. The image most people have, the nurse at the bedside, monitoring, comforting, assessing, that's not where most of the shift is spent. Instead, the single largest chunk of time, documentation. Roughly 1/3 of a nurse's entire shift is spent charting, not talking to patients, not touching patients, not even being in patient rooms. Typing, clicking, navigating drop-down menus. Documenting care that already happened, often to satisfy billing requirements, regulatory demands, and legal protection. In other words, nurses are caring for patients so they can document it, not documenting so they can care. The study also revealed something lawyers understand very well. Unseen work doesn't mean unimportant work. Beyond documentation and bedside care, enormous amounts of time were spent on care coordination, communicating with physicians, locating equipment, administering and double-checking medications, walking, sometimes miles per shift. One nurse in the study alone walked the equivalent of a small city commute during a single shift, over 3 miles. That's not inefficiency, that's workflow design. Hospitals are built for charts, not humans. And that's the problem. Now, here's where it gets uncomfortable. Hospitals added electronic medical records to improve safety, checklists to reduce errors, policies to ensure compliance. But the study shows something paradoxical. The more systems we add to protect patients, the less time nurses have with them. And when nurses are pulled away from the bedside, 3 things happen. Subtle patient changes are missed. Clinical intuition is interrupted. Responsibility becomes fragmented. And fragmentation is where errors and lawsuits are born. Remember, this podcast is called Smart Lawyers Love Dumb Nurses. Why this matters to lawyers and juries? Well, here's the hard truth. When something goes wrong, the chart becomes the story. Not the hallway walk, not the equipment hunt, not the interruptions, just the documentation. And juries assume something dangerous. If it wasn't charted, it wasn't done. But the study shows us the inverse may be just as true. If it was charted, it may have cost time somewhere else. Nurses are being forced to choose between presence and proof. And smart lawyers know this. They don't hate nurses. They rely on the system to expose its own contradictions. And the real question this study asks. This study isn't asking if nurses work hard. That's already settled. It's asking something far more uncomfortable. Have we engineered healthcare in a way that makes failure inevitable and blame predictable? Because when bedside care shrinks and documentation grows and liability still falls on the individual, that's not a nursing problem. That's a system problem. So, the next time someone says, "Where was the nurse?" maybe the better question is, where did the system put them? Behind a screen, in a hallway, chasing compliance. And until we confront that truth, honestly, legally, and ethically, smart lawyers will keep loving dumb nurses. Not because nurses are careless, but because the system keeps handing them the pen. In the court of public opinion, there are seldom more tragic verses. Smart lawyers get rich on the deeds of dumb nurses. My name is Dr. Brian Smith. Stay focused, stay prepared, stay kind, and stay tuned.